The Health Minister Greg Hunt is seeking fresh advice about whether COVID-19 vaccines should be mandatory for anyone working in aged care. It comes as a handful of workers and residents test positive to the virus in Victoria. Mr Hunt has defended the Commonwealth's handling of the sector, arguing every aged care facility in that state has now been offered a vaccine. For more, let's cross to political reporter Jane Norman. Jane, the latest on the coronavirus cases in Victorian aged care facilities.
Yeah, Karina, well, Greg Hunt held a press conference a little while ago and he confirmed that at the Arcare Maidstone facility that our reporter was just talking about, it's actually a 99-year-old woman who's tested positive to COVID-19, so a resident of that facility. We're told she has had at least one dose of a COVID-19 vaccine, but obviously her case was serious enough for her to be transferred to hospital this afternoon. And at that same facility, they're testing a 95-year-old resident who returned a negative result, but there are some queries over that. Now, the second facility that's been affected, the Blue Cross Western Gardens, well, a worker there has also contracted the coronavirus and testing is now underway at that facility and restrictions are being put in place to protect the vulnerable residents there. Now, the lesson we learned from the coronavirus outbreaks last year is that COVID-19 can be lethal when it gets into these residential aged care facilities. In Victoria alone, more than 650 elderly Australians died in aged care facilities from COVID-19. So that is clearly why authorities are so worried and so anxious about this handful of cases, knowing just how quickly it can spread and just how deadly really this virus can be in these settings.
Jane, the Health Minister has indicated he's keen to see COVID-19 vaccines become mandatory for aged care workers.
Yeah, this is an interesting shift and it's clearly been prompted by this situation in Melbourne. So the AHPPC, which is sort of the key medical advisory group on COVID-19, has been really reluctant to make COVID-19 vaccines mandatory. We've seen some states move away from that and make it mandatory for workers in hotel quarantine, in border sort of areas to be vaccinated against COVID-19 before they're allowed to work in those facilities. Well, it looks like aged care workers could be next, with Greg Hunt confirming today that he and the Prime Minister have written to that very committee, to the AHPPC, asking for fresh advice about whether these vaccines should now be made mandatory for anybody working in the aged care sector.
That had been previously looked at by the Chief Health Officers of the states along with the Commonwealth, and the Prime Minister and myself have asked the medical expert panel to review that decision. That was not recommended at the time, and we have asked the medical expert panel to review precisely that question.
Finally, Jane, Labor has attacked the government's handling of the sector, questioning why staff have been allowed to work across multiple facilities.
Yeah, I mean, aged care is a federal responsibility. It is regulated and funded by the Commonwealth. But what we have learned over the past few days is that workers in the aged care sector have been allowed to work across multiple facilities. That is what is commonly done in the sector. But the big lesson from last year's outbreaks is the danger of staff, importing or bringing the coronavirus into these aged care facilities if they're working across a number of facilities. So last year it was actually banned. A single site rule was imposed, and we've learned that at a state level, Victorian authorities have maintained that ban. So workers are only allowed to work at a single facility, but the Commonwealth lifted that ban last year. It was only reimposed last Thursday when Greater Melbourne was considered or declared a COVID hotspot, and so Labor has been asking a lot of questions today about how that was allowed to happen. The Health Minister Greg Hunt confirmed that it was only a minority of staff who were working at more than one facility. He said about 1 in 20 staff. He said that it would not be reasonable or proportionate to dictate where staff can work when there isn't an outbreak like there is now. But here is the question really put by the Shadow Health Minister, Mark Butler.
The ban was reintroduced. That is a good thing. But in the interim, we've seen an aged care worker who worked, as I understand it, at the Arcare facility at Maidstone, working in another facility as well, potentially exposing residents at that second facility. So I think the government needs to explain why they thought the risk had receded to such a degree that it was able to lift the ban that was in place last year.
That was the Shadow Health Minister, Mark Butler there, Karina.
Jane Norman reporting from Canberra.